Hello and welcome to On the Record. I'm your host, Jerome Sawyer. On Wednesday, the World Health Organization declared the novel coronavirus outbreak a global pandemic. The virus now has a foothold in every continent except Antarctica. By midweek, there were over 118,000 confirmed cases and more than 4,000 deaths. And it has become the world's most recent health threat. The coronavirus, known as COVID-19, is edging closer and closer to the Bahamas with each passing day. So what will that mean for a country already recovering from a disastrous hurricane? What are the ripple effects? What will be the eventual cost to our economy, which is almost entirely dependent on tourism and financial services to generate foreign earnings? And what happens to us when our people stop traveling? Tonight, we take a look at the health, tourism, and financial implications as we discuss the global health crisis, coronavirus. Our conversation begins on the other side of this break.
Where in the world is Matt Lowell? Where in the world is Edison Greenslade? And so these about the
Listen,
value of passenger in Atlanta. So we can talk about it.
On the record tonight, the government's purchase of the Grand Kind is a hot subject in the news. Welcome to On the Record. I'm your host, Jerome Sawyer. Thanks for watching tonight. From December, we have watched the evolution of a new strain of coronavirus, COVID-19, become one of the fastest moving health threats on the planet. While many Caribbean countries like the Bahamas have watched from afar and made preparations for its almost imminent arrival, we are all wondering, is it enough? With the Dominican Republic, Jamaica, St. Vincent and the Grenadines, Guyana and Cuba, all with confirmed cases, what does that mean for us? Well, the Prime Minister has said that we will take no chances with coronavirus. We are all concerned over the eventual arrival of this virus to our shores. My guest tonight here to put this all into context is the Member of Parliament for Freetown, but more importantly, the Minister of Tourism and Aviation, the Honourable Dionsio, as well as the Deputy Chief Medical Officer, Dr. Delon Brennen. Gentlemen, thank you for joining us. A very crucial night for us. We have a lot to talk about. This has been something that has been in the headlines, in the news cycles now for the past few weeks. Everything seemed to have escalated last night with President Trump's announcement. But Minister, I want to start with you. A story that has been just churning on social media, on the lips and mouths of everybody today. It was reported that the Fred Olsen Cruise Lines was coming to the Bahamas with 5 confirmed cases on board. What can you tell us at this hour? Is that happening? What is the government's decision relative to that?
I think the Prime Minister has been very clear on this, that there is no ship. That ship is not coming into our waters and not coming into our jurisdiction. You're absolutely right. The ship has, I believe, 5 confirmed cases of coronavirus on board. Many of the passengers are elderly, and so therefore in a very high-risk group. And the government of the Bahamas doesn't want to take the risk of allowing that into our jurisdiction. Most of the citizens on that ship are British. I think 90% of the passengers are UK citizens. And the Prime Minister would have mentioned that he spoke with the British High Commissioner and informed them that sadly we would not be able to accommodate that ship in our jurisdiction.
Was it ever being considered?
The conundrum was that it's a ship that's flagged with the Bahamian flag. And so, that caused a momentary pause. What are our obligations under that agreement? But I think at the end of the day, national security trumps everything. And the government felt that in the interest of national security, it was best to allow the ship to go on to another jurisdiction. The fact that 90% of the passengers are UK citizens really provides options for that ship. There are British protectorates and territories in this region, and so we felt that they would probably be in the best position to accommodate the ship.
This isn't the first report we've had of this. Is not the first time you have been faced now with a ship wanting to dock here, having been turned away from other ports. What is the protocol, or is it on a ship-by-ship basis? And of course, the question on everybody's minds is, why are we even considering this?
No, we haven't. Obviously, this is a medical issue. This is not something that the Minister of Tourism would interject on. It's strictly, there are certain medical protocols that the ship has to follow. And if on board is identified a passenger with proven coronavirus, that ship is not allowed to dock and is advised to move on to another jurisdiction or to return back to their home port.
Dr. Brennen, I'm going to bring you in now. This has been declared a pandemic by the World Health Organization. Explain to us what that means.
So in the general terms, pandemic really means that you have an outbreak, usually of an infectious disease. So in this instance, coronavirus is able to be passed from one person to another. And it has established routes and is establishing community transmission in multiple other jurisdictions. So if you only had it in one area, in one geographic area, if you think back to like Ebola of 2019, that was in one geographic area. And while they had cases there and there was an outbreak going on there, that's not a pandemic. That's more like an epidemic. But once an epidemic now happens in multiple different jurisdictions and you're having community transmission there, it's then referred to as a pandemic. And now having almost 110 countries around the world with it, you can truly say it has established roots in multiple other jurisdictions. So that's how it fits now, the definition of a pandemic.
We almost had a case of hysteria yesterday where a suspected case, or people suspecting a case, appeared at the Fleming Street Clinic, and there were images of people running from the clinic, and there was all this hysteria. First of all, could you explain to us exactly what happened?
Sure.
And how is that allowed to happen? Or, when you have so-called trained professionals inside a clinic that's supposed to be helping people, explain to us exactly what went wrong.
Right, so I think there's a combination of factors that really happened here. It's the fear and the hype that's happened through social media, through traditional media, and people's exposure to myths rather than the truth that goes along with this particular issue is what is fueling people's reactions. And people are human, so whether you're a medical professional or merely a lay person, you have your own inherent fears, and if something happens immediately, you may revert to relying on those fears rather than your training. And so what happened is there was a Jamaican national that came to the clinic, and that person had symptoms of a viral illness. So they had, runny nose, cough, wheezing, much like they would with any other viral illness, not specific to COVID-19. But if you also remember, the day before that, Jamaica had encountered its first case. So people heard the word Jamaica, they heard someone with fever and cough, so they automatically jumped to, oh, this must be COVID-19, and it became a little bit of an issue.
That's a big issue. Right? But I understand. I want for you to explain that what is the protocol if somebody presents or suspects that they may have symptoms, or they present with these symptoms. What is the proper protocol, whether it's at a clinic, whether it's the hospital, or even a doctor's office?
Sure. And so what we have sent out is we've sent out a protocol specific to COVID-19 and an algorithm that goes along with it that says if you have someone that comes to your facility, in this time period, regardless of whether you think they've traveled or not, what you do is if that person has cough, they have respiratory symptoms, you then have that person, you place a surgical mask on that person, because what you really want to do is stop their respiratory droplets from being able to be spread anywhere else. That applies to the common cold, it applies to the flu. You just want their respiratory droplets to not be spread onto anyone else. You then take that person and you place them in an isolation area, again, so that you protect other people who are in the facility from getting any of their respiratory droplets, spread anywhere and getting onto other people, which is exactly what happened in the facility. It was when that happened, you put a mask on someone who had symptoms and put them in isolation, everyone jumped to the conclusion of COVID-19, but the healthcare providers actually did exactly what we would have wanted them to do. It spiraled out from there, but realistically, once you have the person isolated, we would then ask that they call our surveillance unit, call the Department of Public Health, the Ministry of Health. We've provided hotlines. There are multiple numbers on all the updates we send out. Our numbers are at the bottom. So you just call the number and let us know what the situation is. We will then advise from there as to what you need to do in that situation as a healthcare provider, whether that person really fits the case definition or not, or do we need to come and have more conversation with them? And then if something comes up and we say, okay, this person really kind of does fit the case definition and they are currently symptomatic, this person needs to be isolated in a healthcare facility so that we can address their healthcare needs and keep them away from the general public as well. And that transportation would then happen, and we've designed the mechanism for how that's going to happen.
Minister, last night to me was a game changer. President Donald Trump addressed the nation and announced a travel ban on Europe, save the UK. But in many ways, that was a defining moment to me, and I think to so many others, as to where we are in this crisis. What does that mean now, singularly for the Bahamas?
Well, you're absolutely right. It was a transformational moment when President Trump banned travel to the United States, cargo and people, from the Schengen countries, which is basically continental Europe, excluding Ireland and Great Britain. Everybody was shocked by the statement, and immediately we began to consider how is that going to affect us. I think what it did, certainly from a tourism standpoint, it made everybody gasp and everybody think, wow, this is really a major event. And unfortunately, I think it is people who were teetering on whether they should go on vacation or not go on vacation. It really probably put the nail in the coffin for people to continue to travel. Certainly, if you have plans, our records last week were showing that they were going to follow through March and April. Our arrivals were looking rather robust. Now that this announcement has been made, I think there's been a rush to cancel, and I think a lot of people are reconsidering their travel plans in its entirety. And I think everybody is going to base. Everybody's going home, and they're just going to hunker down and see how this develops and how this evolves before they make what I consider non-essential travel, which is what a vacation is, right? And so, unfortunately, it is going to bring a screeching halt to world travel, probably for, he said, 30 days. But certainly, even if you have plans now, you're not thinking about 3 months or 6 months into the future and how you're booking. And our numbers reveal that our advanced bookings are going down substantially.
We rely on tourism. It is the mainstay of our economy, of our country. It's where our people are employed. It's how we live. What was that conversation like this morning amongst you and your cabinet colleagues about what are we going to do?
Tourism is an industry that is often subject to shocks. I like to tell everybody that certainly in the last 12 months, we've had a travel advisory issued by the United States about potential crime problems in the Bahamas. We've had a shark attack. We've had Hurricane Dorian. And now we have the coronavirus. And while these events are impactful and they cause short-term shocks to our economy, tourism is very resilient. And if you look at, I was reading a report about the stock market. What should you do? Stock market is down, there's all these shocks, you travel, stocks are down, the airlines, hotels are all significantly impacted. And, they're saying, okay, first quarter is going to be bad. Second quarter is probably going to be worse. But third quarter is going to start to rebound. And by the end of the year, it should be back to normal. And what it shows is that, and I don't know whether this is the case or not, and I remain hopeful that it does. But the American economy provides 82% of our foreign visitors. Unemployment is at a record low. The economy is exceptionally strong, and everybody seems to be opining that they can weather this. And there's going to be the initial shock of this coronavirus, and everybody's going to get very, very hyped up about it. And then it's going to become, at some stage, the new norm, and people will begin to adjust back to their normal lifestyles. Now, this is obviously a projection, and this is what people are thinking. Only time will tell. But tourism is an extremely resilient industry, and I think in time it will surely bounce back. I don't know how long it's going to go for. Obviously, we've had shocks before. We've had 9/11, we've had the Great Recession of 2008, and over time it trended back to the numbers that it was pre the event.
Dr. Brennen, for those in the medical industry, it's like you're sitting on the shoreline almost waiting. What kind of strain is this putting on our services? Obviously, we're not having to treat, but there's so much preparation and even I'm sure anxiety. I mean, which we saw played out yesterday. Yeah. I mean, how is that affecting even our ability to deliver healthcare?
I think much like the tourism industry, healthcare is fairly resilient as well. And what we're seeing is we are going through, and one of the things that's often said, even by our minister, is never waste a disaster. And so what we're using this for is to continue the training when it comes to the use of personal protective equipment. How do you train for if a contagious case comes to your doorstep? We used the same approach when it came to Ebola in 2019 and in 2014 when H1N1 was there in 2009. We've been using this approach of what's going on in the world. And once we know what that is, let's use that as practice in order to get ourselves prepared. So yes, there's a lot of hype and sort of fear that goes on. But once you boil it down to it, it gives us the opportunity to learn, to train, and then to update ourselves on that it's really a global society, and we need to know what's going on in the globe, because we can't just think, oh, well, that's happening over there, it's never going to happen to us. Because as people saw with the coronavirus, within 24 hours, you could have it not just on your doorstep, but infiltrating your healthcare system. So we need to make sure everyone's prepared. That's why we do it in our family islands. We do it in the private sector. We share it as widely as we can. We get other stakeholders involved, whether that involves the tourism industry, but also those from agriculture, those from immigration and customs, because we all have to act as the ears and the eyes of the healthcare industry, because if something happens, we're a very small community, and we need to know as soon as possible, because it could also infiltrate our very small community very quickly, and we could have a really large problem with the workforce in the country.
We'll definitely talk about that a little bit more after our break. Stay with us, you're watching On the Record. It's a show you don't want to miss tonight. We'll be back right after this. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for.
This portion of On the Record brought to you by Executive Printers of the Bahamas Limited. We print profits for you.
Welcome back. This is On the Record. I'm your host, Jerome Sawyer. This segment is brought to you by Executive Printers. As of this morning, there were over 128,000 confirmed cases and almost 4,800 worldwide. And there are about 16 cases in the region alone. But as a nation that welcomes thousands of visitors daily, those numbers may not remain the same for long. While our numbers may attract more visitors to our shores, with each visitor comes an increased chance of this virus making landfall. My guests tonight, the Minister of Tourism and Aviation, Dionsio, and the Deputy Chief Medical Officer, Dr. Delon Brennen. Dr. Brennen, the Minister of Health is on record saying that it's not a matter of if, it's when the first case arrives. And just recently, he would have predicted worst case scenario, we could get to 400 infections. A lot of people will ask, if something like that happens, what is our capacity to handle?
I think what we are relying on is a whole of health and a whole of government response. And that's been our approach from the very beginning. So our healthcare capacity in country is built on both usual case scenario, but also some surge capacity to go along with that. And so what we have done is within our public health structure, but also in collaboration with the private structure, is say, how many beds would we be able to do just in the institutions alone? Once we did that evaluation, we realized if you get out to a worst case scenario, you're going to need more bed capacity than even we had built in for normal surge. And so what we have started to plan is having, a sort of field hospital or tent hospital setups so that we would be able to surge really quickly to be able to move up to those levels. So 20 or so beds at a time would be set up in order to address that capacity. Ideally, of course, we hope to never get there, but we have some capacity that's being built on site at the hospital, but we're also doing some at off-site locations as well, so that we know we wouldn't necessarily have as much cross-contamination, but you also would be able to spread people out and not necessarily concentrate it as much, whether for security reasons, for safety reasons, all of that being combined, using the best sort of technical knowledge available.
One of the things that I think people don't even realize is that everyone who is diagnosed doesn't have to be treated at hospitals.
Correct.
And why is that?
I think if you look at the general epidemiology we've seen over the past 2.5 months, if you consider out of 100%, about 80% of people have very mild symptoms. So many of them don't need to be in hospital to be treated. And if you're able to address their symptomatology at home or in a home-based setting, they can run through the 2 weeks or so course of disease, of their runny nose, their cough, their fever. As long as they stay hydrated, they take something for their fever, they will do fine without having to be in a medical institution. You're really only talking about maybe 15 to 20% of people who do get sick with the virus will have severe disease and may need hospitalization. And an even smaller number of those will have very severe disease and need ICU type of evaluations as well. So, just looking at what has happened across the world when it comes to the infections, we can kind of plan based on those types of numbers. But if you can isolate people at home and keep them away, sort of social distancing, then for the most part, it's just as good as having them in an isolation facility, because either way, you just want them to be protected and for other people not to be infected by them.
Minister, we are a country that has numerous ports of entry, seaports,
indeed.
airports. People are constantly moving in. We rely on people coming here to make money. What protocols are in place to detect, to properly screen people who are coming into these ports, and sort of people want to know or have some level of comfort that we are doing some level of proper screening and detection.
So first of all, not every passenger coming into the country is being screened for the COVID virus, right? So we have banned visitors, non-residents, who have traveled to certain countries where there has been a large outbreak, namely China, South Korea, Italy, Iran, are the countries where people are not allowed to come to the Bahamas. So obviously when you either come here by ship or by plane, generally what happens is they ask you the question when you're checking in, have you been to either one of these countries? And you get screened out there, and then our immigration officers, once you land, so that's the first line of defense, and the second line of defense is that they ask you again, have you been to one of these countries? I came in the other day, and I don't know if they did it because it was me, but they did it, and they asked me where I'd been, and if I'd been to any of these countries in the last 20 days. So we've gone over the top. Most countries are saying 14 days, We've added another 6 days to that, say 20 days, because we figure it takes 14 days to present. So we want to know by the 20th day whether you're into a full-blown flu, and therefore probably would not travel anyway. So far, so good. Obviously, the Minister of Health and the Director General of the World Health Organization have said that it would be odd if it didn't go to every single country on the planet. So all we do is we plan and prepare ourselves should the unfortunate situation present. But you're absolutely right. The country is extremely porous. There are many ports of entries. People can come in private ships, private planes. But so far, so good.
There's also, the government announced the formation of a task force, I think,
Correct.
to oversee this particular issue. What is the function of that task force? What are they doing separate from what other government agencies and entities are already empowered to do?
Well, I think the Prime Minister created this committee so that he could have all of the relevant agencies in the room. I mean, obviously, you've got the health aspect, you've got the tourism aspect, you've got national security, you've got a whole number of issues, public relations, how the message should be sent out, because if that isn't handled properly, you could have a panic situation on your hands. And so he felt that it was necessary to form this committee, to have all the relevant agencies and the relevant disciplines in one room to help manage and message this crisis.
This wasn't happening before, or?
Yes, I think it was more health-centric. And so the Prime Minister decided to get other disciplines into the room and to chair it himself. I think it started off, okay, the health area is handling this matter, but it's now taking on a greater relevance and greater importance, and people are extremely concerned about it. And I think that he felt that, okay, I need to jump into the captain's seat and manage this day-to-day, agency by agency, department by department. So he formed this committee.
How much of this is hysteria? I mean, it's the first thing we see in the morning, the last thing we see at night. We are
And then all
bombarded
through the
with it throughout the day on social media. How much of it is hysteria, and that's really feeding into our fears?
I think a significant amount of it is hysteria. The hype around it has definitely allowed us to sort of get our messaging out, however, because as much as we might fight from a health standpoint to say people need to do this, as simple as washing your hands.
Oh, everybody's washing their hands.
Right?
What, every minute?
Everybody,
But we've been asking for that for years. This is not
and
brand new,
everybody
right?
has sanitizer.
Exactly, but this is what we've been asking people to do for many, many years. We've been asking people to have good respiratory etiquette. If you're going to cough or sneeze, do so in your elbow. Don't do it in your hands. But everyone pays attention to it now. So this is where it's actually a sort of an advantage to see it happening. And nobody wants other people to be ill or to die. But being able to take advantage of these things happening elsewhere at the moment so that we can prepare ourselves from the community, from the person who doesn't pay attention to their health at all. And I can take the message now of you need to get a flu shot to people where now they actually might pay attention to what I say. Because as the World Health Organization has said and other health entities, if there's going to be a treatment or cure that's made for this, it's going to be a vaccine. Well, we have deaths, about 100,000 deaths due to flu worldwide so far this year. We've had 4,000 due to COVID. So if you really want to protect yourself against what is happening right now, not in the world in general, but here in the Bahamas, then get your flu shot. But people now accept that message and they're like, oh, well, I'm going to go get my flu shot tomorrow, when we've been preaching this for years, if not at least for this flu season for the past 5 months, but it's only because this is happening. So while I do not want the hysteria to continue to make us to make really poor, rash decisions, we also have to take advantage of that and turn it into, well, now that we have your ear, this is what else I would like you to do at the same time.
I want to talk a little bit about the statistics of all of this. It has a very high recovery rate. And also, in essence, 4 out of 100 people die?
Yeah, so anywhere between 2 to 4% of people who actually get infected will die. We've seen that rate be a little bit higher in China, and it's really a little bit lower when it comes to outside of mainland China. But when you average it out, it's about somewhere between 2 to 4% of people who get the infection will die. Again, if you look back at SARS in 2002, 2003, that rate was as high as 10%. SARS was a lower level because it wasn't as many people and you got severe disease, so it didn't spread around the world as much as this one is. When you have so many people now with mild disease, you get them to spread because they can travel, they can get on a plane, they're not all hospitalized. But you definitely are seeing less percentage of people die, a lower case fatality rate, but definitely larger numbers only because it's now spread so far around the world.
And the recovery rate?
The recovery rate, again, you're only getting about 4 to 5% of people. So you're talking about 95 to 96% of people will recover, eventually without any sequelae.
And I think there's probably a number of people who probably have this virus who aren't tested. And so they're not factoring into because the deaths divided by people tested gives a high percentage, but deaths divided by people tested and not tested who have the disease will probably, as time goes on, drive down the percentage.
Minister, from a country perspective too, there are even concerns. People are targeting a particular ethnicity of people and saying, I don't want to eat from these folks, or I don't want to do business with them. I mean, and when you think about it, it's kind of crazy.
Yeah, you're absolutely right. I mean, this virus isn't targeting, certainly in our jurisdiction, doesn't target anyone, but I'm sure if and when it does arrive, it's not targeting any particular ethnicity or nationality. I think that social media likes to hype these things up, like in the Fleming Street Clinic. Oh, it's a Jamaican national. What does it really care what nationality the person is? A person presented with what was one thought might be the symptoms. But I think we have to be very, very careful and have to be very, very responsible not to conclude that this is weighted to one nationality or another nationality or a different ethnic group. We do know, and the health professionals will advise us, that this targets, certainly in the fatalities, older people. And so we have to be careful not to, if we have the flu symptoms, to make sure that our grandparents and our older members of our household are protected against people in the home that may present with some flu-like symptoms. And so we have to protect those members of our community.
I'd like to know what have the conversations been like with your partners in the airline industry, especially they are, and the cruise ship industry, as they are really feeling the brunt of this right now.
No doubt about it. They have suffered significant, 30, 40, 50% decreases in customers.
Wow.
And so they're going into mitigation mode, which is, what do I do with all these ships that no one's traveling on now? Because, if you think about it, a cruise ship comes into a port and then goes back out. And the vast majority of time, they're out at sea. Or they're spread out over all these ports around the world. But now, if no one is using them, they all have to go back where? So they need to be parked somewhere. Airlines are parking planes, laying off people, airports, cargo. The effect on the travel industry is just huge. I watched a documentary on Frankfurt Airport in Germany where 60% of the business is down. They're parking planes, sending people home, unpaid leave. It is quite traumatic, the effects that it's having on travel and tourism. And tourism is a huge business, probably the biggest business on the planet. And it's being significantly impacted where everybody's deciding to stay home. And that is having a knock-on effect of monumental proportions around the world. So, the quicker we get through this, the better. The quicker we see the end of it.
Have we seen any decline in loads on Bahamas Air at this point?
Every airline has. I think a lot of Bahamians, are saying, well, I'm not taking this trip, I'm not going to Florida.
I'm one of them.
Yeah. You've heard of an outbreak in Florida, you decide, it's not essential. I don't have to go shopping in Florida
I can
right now.
order it online.
Yeah, so, and that is having an effect on every mode of transportation that involves the tourism sector is being affected by this outbreak.
Dr. Brennen, people naturally become fearful at a time like this. And we are always asking ourselves, what can I do? What should I do? We're in the workplace, our kids are going to school, we have to interact with people, we're going to church, we're doing all of these things. It's not on our doorstep, well, literally it's on our doorstep, just not in our yard as yet. But, you know, a lot of people like myself ask, what can I do? What should I be doing? Should I go out and buy food? What should I do at this point to try and protect myself and be ready?
I think the public health side of things, so just from a health aspect side of things, we need to make sure that we're doing everything we can to protect ourselves health-wise. So you need to make sure that you continue to do the things that you know keep you healthy, the messages we've been trying to get across. You need to eat well, have an appropriate diet. If you need to take multivitamins, do that. Exercise. Those are the things that are going to keep your body healthy so that if you do encounter it, then you are able to stay well at the same time and not suffer some of these monumental, you know, or catastrophic effects that can happen from it. Outside of that, the big things that we ask people to do is wash your hands. You know, soap and water works. You know, there's a big run on hand sanitizers and the like, and we're not saying that that's not something that you can use, but good old soap and water works just as well to be able to eliminate those germs from your hands as hand sanitizer does. So wash your hands, 20 seconds. If you want to hum happy birthday, Mary had a little lamb, whatever you want to do in your head, think about it, because 20 seconds, while it sounds short, when you're trying to wash your hands, is a significant amount of time to do so, because we're just not used to doing it for that long. So wash your hands, have good cough etiquette, cough into your elbow. If you see other people who are coughing or sneezing, stay away from them. At least distance yourself 6 feet from them so that you know that those respiratory droplets that they put out aren't going to get onto you. If you can isolate people who are sick, you know, you can deliver them food, water, whatever, but so that they are able to keep themselves healthy, but they're not going to spread it to someone else, do so. The biggest thing that we're telling people with it at schools and at workplaces is if you are sick, stay home. Do not bring your illness to everyone else.
Stay home.
Because that's what's
But only if you're sick.
thing. That's what. But notice, if you are sick, stay home. And I think that's
Don't stay home to be staying home.
Because if you don't, you end up having these bigger issues where you start spreading into other people. And I know people are started worried about, it didn't really hit home as much until they started canceling mass gatherings. And when that happened, people were like, oh, I should really take this seriously now. And the thing is, because it's not necessarily on our doorstep, this particular illness isn't on our doorstep, yes, we should think and have some pause to these mass gatherings, but it isn't as though we're telling you, as of this very moment, cancel everything, cancel church, cancel school, cancel, you know, any concerts, things like that. What we're saying is be smart. If you are the one who's sick, stay home. Because if you're the only one who's sick and you don't go to the event, you're not going to spread it to anyone else. Everyone else is safe there.
Makes sense. Gentlemen, we are out of time. Thank you so very much for coming and talking with us tonight. This is obviously a global crisis in many ways, and certainly we are a part of that community. So thank you very much. Very important information shared with our guests tonight. With our audience tonight. Thank you for stopping by and being our guest. Stay with us. Our show continues right after this quick break. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
You're watching On the Record. I'm your host, Jerome Sawyer. Thanks for staying with us. Well, with tourism reaching a record-breaking 7 million visitors last year and recent heads of agreement signings for major developments in Grand Bahama and Abaco, and here in New Providence, the tourism industry seems to be booming. Well, all that ultimately means that we should be experiencing the benefits of a robust economy. However, with the threat of the world's latest pandemic, that can change in moments. Discussing what this global threat means for our economy and the average Bahamian is my guest for this segment, Mr. Edison Sumner. He's the founder and principal of Sumner Strategic Partners. Thank you so much for joining us.
Pleasure.
I want to talk a little bit first about the key concerns for the economy itself. When you look at a health crisis like this, it has a residual effect. What are the key concerns for us right now?
Well, initially it's going to be about whether there's going to be a slowdown or even a full stop to activities in the economy, based on the fact that our economy thrives largely on tourism and financial services. Both of those industries require, to a great degree, tourism more than financial services, for there to be persons coming into the country to either enjoy a vacation or to conduct business. If the idea of this, or this concept of this virus going out where it's affecting people's ability to travel to get into the country, then that is going to have, in and of itself, a tremendous impact on the economy almost immediately, because there's going to be an immediate cessation of spending, of capital coming into the country. There's also going to be the concern that those who do not necessarily travel for business but are conducting transactions cross borders may also be impacted. And I'm talking about retailers, wholesalers, and those who are in the business of selling products, where if your product is coming in from a place like China or some other jurisdiction that has already been exposed to the virus, there's a very good chance that those jurisdictions may decide that they're going to stop moving product out of the country or into their jurisdiction. And that will also have an impact on your borders and the ability to import product into the country. Now, the severity of that potentially are not incite any level of fear, but the severity of that could be that there could be an implication on our ability to import essential items like food, right? Although I think that if we manage our borders properly, then we might be able to mitigate that, whereas you only really move product and people who are directly involved in that industry or that particular transaction moving product around. But I think the severity of this on our economy could be catastrophic, especially given that we are still trying to really deal with the aspects of the aftermath of
Which brings me, I'm going to jump to I have a question here on the supply chain. I mean, you talked about this could have an impact on food supplies coming into the country. How real of a threat is that?
I think we should consider it a real threat, right? And that we should begin to exercise some kind of mitigating factors to reduce the threat as much as we can. I recall coming out of several hurricanes in the past. The first of my recollections going back to 1993, I think it was, when we had to deal, 92, when we dealt with Hurricane Andrew. Andrew shut down the borders of this country, and it shut down our supply chain, which was South Florida, where most of our supplies either come from Florida or they transverse through Florida. And we were shut down for a while. And I believe at the time we were concerned that we had food supplies in the country that probably would have lasted us about 21 days, right, before there was another shipment due to come in. And it sort of set some level of panic amongst everyone. It's like, oh, we've already had a run on the food stores, we've emptied the shelves, and now the major food store suppliers and the food chains in the country were concerned about when they would get the next supply of product coming into the country. This could have a similar kind of an impact on us, in that if the government here decides to shut down its borders, that's one thing. But we have to also be concerned whether the supply chain is shutting down their borders, right? We already see where a particular cruise line has already talked about shutting down their cruises for about 60 days. If our supply chain shuts down, it'll be just as bad as if our borders had shut down, because if ships that are carrying goods and products that we need for our survival aren't able to leave their port of call, then us having open borders really wouldn't matter, because the ships aren't leaving anyway to come in. So I think it's the kind of thing where those who are in charge of the maritime services, who are protecting and servicing our borders, particularly the ports, will have to be very cognizant of what could become a reality if this virus decides to spread itself into the Bahamas.
When you look at economies like the United States and even the larger economies across Europe, they're already showing signs of slowdown. Things are already starting to happen. Again, a residual effect to us. I mean, we've talked about the tourism side of things, but you know, right under tourism for us is financial services and other, you know, another thing. So once that starts to happen now, what are the sort of red flags that we should be looking for?
Well, the first thing you look for, let's go back to the capital markets in the United States. We saw that now for probably 5 days straight. We've seen declines in the stock market. The Dow has been declining, S&P's been declining, NASDAQ has been declining. We saw, again this morning, major sell-offs of major industries. And so a lot of companies and individuals have been losing a lot of value over the last 5 days, right? So that will have an impact on capital markets all over the world, London, Tokyo, and other places, and it will have an impact on us as well. So red flags that we should begin to really consider is, one, the United States has already issued a travel ban against Europe, largely, right, with the exception of Great Britain and other parts of the United Kingdom. That should become a red flag for us, because once you issue a travel ban against one of your largest trading blocks, then what is there to stop the United States from issuing similar advisories now against other states? The Bahamas is the closest neighbor to the United States offshore. We do a lot of business with the United States. Most of our tourists that come into the country come from the United States and Canada. And if this issue becomes an issue in the country, then the United States, as would be the case with any government looking out for the welfare of their citizens, might decide, for our safety and yours, we're going to now shut down the borders going to these other countries. It doesn't matter to them what the impact is going to be on that country, as we heard from the President of the United States say today when they talked about the impact of his advisory against Europe on the capital markets. His response was, well, it may have an impact on the capital markets, but I'm more concerned about the welfare of my citizens. So red flag number one, the world is going to follow the lead of the United States. And the first thing that they did this morning right out the gate was, we're going to shut down travel between the United States and Europe. That for us should really become a red flag. And if I were in the Ministry of Aviation and Tourism, I would really consider that very, very seriously, that if it happened there, then it may be an eventuality where it comes on our shores as well.
Very quickly before we go to the break, stock market is said to be in a bear market. What does that mean, and how? Well, I mean, what's the effect that we can expect to see from that?
Well, in the stock market, you have what is called a bear market and a bull market. A bull market is when the stock market is doing well, when there are consistent sessions of increase in stock value. A bear market is the exact opposite. When there are consistent sessions, they call trading day sessions. When there are consistent sessions of decline, then you go into bear territory. So if you have 5 or more consistent days of decline in the market, then automatically they're going to declare that that's a bear market. And what the stock market will do, and this is again how there could be some mitigating factors in this as well. When you have consistent declines in the stock market and you get into bear territory, it is not uncommon for the stock exchange to say, we're going to halt trading for a period of time.
And that happened last week.
It happened last week. And it happened 3 times in a single day. So that what they're saying is that for us to stop the bleeding so that we don't lose our because the American economy is built on capital markets, right? On capitalism, etc. So when there are constant declines, they're going to stop the trading because they're saying, listen, we're seeing this fall off is happening. It's becoming too rapid. The fall off is happening and it's too deep a cut. So we have got to stop trading. Give you a chance, catch yourself, reassess your position, and we're going to start trading again. But if you start trading again and the markets continue to decline, then they're going to shut off the markets again for a period of time. And it wouldn't be uncommon, as we saw after the 9/11 incidents, where they actually shut down the markets completely for several days. And that had a catastrophic impact on capital markets around the world. And that's how the bear markets work. So as long as there are constant declines in the value of the stock market, then you go into what they call bear territory.
And of course that affects everything, around the world. Edison, we're going to take a break, come back with our final segment right after this. Stay with us. Hello and welcome to On the Record, a debate-style television talk show where Bahamians will find the balanced, true, and open debate they've been looking for.
And the icon goes to On the Record.
On the Record was born out of a desire to do something different. What we do every day helps our country, it helps our society, it helps to shape the views and opinions.
Listen, what is more dangerous than
Gentlemen, we've got to move
corruption
very
is
quickly.
illusion
Let's
or
wrap up.
integrity.
It's all on the record. I'm your host, Jerome Sawyer. Our discussion begins on the other side of this break. This is our final segment on the record. We're continuing our conversation tonight with my guest, Mr. Edison, Sumner's founder and principal at Sumner Strategic Partners. Thank you again for staying with us. The potential effects on the labor force can be great. Already companies are looking at contingencies to have people work from home. And while that may work in some instances, there is a greater risk should schools close, because now it becomes burdensome on what do parents do with children, and so many other things. So I want to talk about the potential effects of this on the labor force itself.
Well, in the first case, I think this, as in any other tragedy or catastrophe, really also presents opportunities, right? And the opportunities here now are that when it comes to the labor force, there is a significant part of our labor force which is service-oriented, where they can now begin to look at taking their services offline, or put it online, I should say, where some services you provide can actually be done now through digital means. I remember speaking recently to the Bahamas Society of Human Resources Managers and saying to them that, listen, you have to start thinking about the evolution of the workplace, where you can now begin to work from anywhere once you have your online presence, so that you can begin to actually be more productive in certain ways. So that's one of the opportunities I think is being presented for our workforce, where they can now consider how can you get work done online and be as present as if you were there physically in the space. But when it comes to our students, looking at the UB first and then the grade school system, it presents a similar kind of an opportunity, right? So for example, we're hearing across America now that many universities are migrating to online classes. I think there's going to be a burst in proliferation of online courses being offered now, even after this has expired, because it's now showing that there is actual value in doing your studies online.
It's a good test.
It is, absolutely. For the students now, I think it's going to be a case where we're near the end of the school term anyway. Easter's only a matter of weeks away. And I think it may be prudent for teachers in the school system, if their kids have to go home, it's to send them home with enough work that would carry them through to the Easter holiday. Give them coursework, give them an abundance of homework to be done, put them on some assignments or something. Otherwise, you're going to have a lot of wasted time. Now, few schools I know in this country actually are providing some of their courses online, because that also presents an opportunity for high schools. How can you now take some of your courses, give your students the ability to log into their work, get the assignments done, submit the assignments online, rather than waiting to get back and handing in hard copies. So this then takes our education system under microscope and gives us this chance now to talk about how can we transform and go through this digital transformation of our education system, where we're now allowing more students to actually do their work online as opposed to having to hand in hard work. We saw this process starting with the introduction of whiteboards in our classrooms, right? Rather than having to write with chalk and on a green or black board, you now can do this whiteboard thing, and it transcends into digital applications as well. So we need to ensure that if it comes to a point where our high schoolers especially are to be sent home for a period of time, that we give them sufficient work that will allow them to remain occupied by the time that they're off. Otherwise, we're going to have an early summer with kids who are just going to be roaming about with nothing to do.
When you I'm looking at worst case scenario now. If people start to, if this shows up, people start to feel uncomfortable about moving around, going to work, etc. What is the domino effect of that? Even right down to, you see things like Jazz in the Gardens being cancelled and these events, and these are things that people have invested millions of dollars in.
Yeah. Well, you're thinking now, we talked about those who can work digitally, but then there are still those in the economy who have to have some level of human interaction. We think about things like auto mechanics or waiters at restaurants, right? But if the people aren't leaving their homes, then those jobs are going to be in jeopardy to some degree anyway. So I think what you'll see happening is that if these individuals have to stay at home, and through this new phase and this new term now called social distance, right? Keeping our distance from everybody else, 3 to 6 feet, that's impractical, but it's something that's being promoted. But if that happens and we find that our workforce now are being directly implicated by this and impacted by this decision to remain at home, then I think that the government may have to actually consider tapping into their disaster management fund for unemployment to now provide some level of subsidy to those persons who are going to be unemployed during this process as well.
That same fund that was tapped by Hurricane Dorian?
The fund that was supposed to have been created by Hurricane Dorian. But this is another thing we've been talking about. You have to treat this as you would a hurricane. And we've said this before. When we talk about hurricanes and natural disasters, a hurricane is not the only natural disaster that can occur in this country. That's only what we've been dealing with. We dealt with the Straw Market Fire, but that was only New Providence. In more specific, downtown Nassau, it had its impact on the tourism sector. But we need to consider this COVID-19 or coronavirus as a natural, well, it's not a natural disaster, but treat it as a disaster, a national disaster. So the same efforts we would take to mitigate against hurricanes, the same effort we will take to effect policies post-hurricane, we need to be taking the same measures now. But the difference is, with a hurricane, we given sometimes maybe days' notice that this hurricane is impending, it's coming upon us. In this instance, we've been given months' notice, right? So if we're not going to affect a plan and a policy to begin to fight and ward off this issue early, then we can't scream that we've been caught with our pants down, because we've seen the signs coming a long, long ways away.
Quickly before we go, to the average person now, looking at all of this, considering that, as the Minister of Health has said, it's not a matter of if, it's when this happens. What should we be doing with our own personal finances? Central Bank would have put out a statement earlier advising people to, to begin to scale back. But what should we be doing with our personal finances in preparation for what could happen?
Well, it's really just a matter of exercising prudence, right? Being smart with how you spend money, which is what you should be doing anyway, no matter what's coming about. But here's the issue that's going to create. Yes, you need to be prudent with spending. You have to scale back on spending to a degree. But when you scale back on spending, you are now beginning to cause there to be perhaps a semblance of a recession. Because that is what a recession is. It's constant periods of decline in your economy and the economic activity.
And you're not spending into the economy.
It's also the lack of spending. And as we said on your show before, when you spend money, it's a currency, right? It flows. It is supposed to flow. And like water, when water stops flowing, it becomes stale, it stinks, and nobody wants anything to do with it. The same thing applies with currency. If currency stops moving, it loses its value. So we need to ensure that, yes, you want to scale back and be more prudent with how you spend and what you spend money on, but we can't stop spending.
Don't stop. Yeah.
Because if we stop spending, then we're going to cause there to be a jackknife in the economy. It's going to turn upside down very quickly, and nobody wants that to happen. I think that if that happens, even the government may not have a plan in place for a jackknifed economy. So we need to be prudent about how we spend our money.
Edison, so much to consider. Thank you so very much. We hope that this information tonight will help people to stop and think not just about the health aspect, but about the financial aspect.
Absolutely.
Because that's so very important for us as well. Well, that's going to do it for tonight's show. On behalf of all of my guests, as well as my technical and production staff, thank you so much for joining us. It's been our pleasure. Hope to see you next week, same time, same place, right here.